Hello world, I'm David Michael Smingy, MD, also known as DMS MD. I'm a primary care provider, board certified in family medicine. Grateful to be here, love what I do. I think that there's just a lot of challenging things happening right now. Have you been to a doctor's office recently? And if you haven't been, you should probably go see your primary care provider. I mean, I am a primary care provider, not necessarily your primary care provider. But my goal with something like this is to help people understand all the really complicated things that are happening in family medicine and beyond in medicine. I'll be honest and say I'm probably just as frustrated as you are as a patient or as a provider. When you go to your doctor, it seems like we just don't have enough time to explain anything that's going on. And medicine's really complicated. It's really difficult to sit down and explain any medical subject in 15 minutes or less and give people the attention that they need, like tailored in a plan for them. It's hard enough to understand hypertension, for example, but then you ask questions about, well, which medication is best? Which medication is best for me? How do you make a therapy plan for a specific patient in the time that we're given? And then also you go to a doctor's office, you're like, man, does anybody really even know what's going on right now? I feel like the world has just lost a lot of trust with their physicians and with the medical community at large, and even our bodies of literature that produce studies and information. It just feels so impossible to get the right answer for anything right now, especially in medicine. So I don't know what to do with that. I feel like as a doctor, I'm really frustrated too. I want to do great work for my patients and for my community and for the people I get to teach and be around in my family, but it's difficult. I can think of all sorts of different constraints and problems that we have in medicine that just frustrate me and they frustrate you. So I could, option one, sit back and just be frustrated with it, or I could try and do something. And I feel like this channel is going to be that something in some way. And I'm honestly really just unsure about what it might even look like right now. But I can't just sit down and just be okay with things as they are. In the words of a famous physician, or maybe a doctor at least, the status is not quo. I feel like we need to make changes in medicine. And I think I'm just going to start by hopefully trying to elaborate on some subjects or some topics or maybe just something to help kind of the world along. And I feel like if a few people even find this channel and can look at things in a different way or maybe understand a topic better and make something smoother for their appointment with their doctor, mission accomplished. I know that even with spending time with me, if you could spend just a few minutes here and I get more out of it, it just sort of duplicates the time. So I'm grateful that you stumbled across this channel, grateful to be here. I do genuinely love what I do, but I also want to see if we can help make some differences in the world, and I'm just grateful to partner with you in doing that. Thank you so much for finding this channel. I'll do my best to post maybe a channel or an update, I apologize, every week or so, and maybe just cover some topic. And if you want to post something, I'd be happy to try and cover it with a friendly caveat and kind of occupational hazard. I am a primary care doctor. I am not necessarily your primary care doctor. I encourage everybody to have a great relationship with their primary care doc. You need one. And I could be that person for you. Also, if you're my patient watching this, just gotta say something here. It doesn't necessarily mean it applies to you either. So, if you got any specific question about anything in medicine that pertains to you, I encourage you, you need to go find your own doctor to do that. But I think for the purposes of education and teaching, I mean, doctor means to teach. I think that's what my goal would be here, if I can make things a little bit easier for you as you approach medicine. So, again, grateful to be here, grateful for you, and have a great evening.